Welcome, come on in.
Hand, foot and mouth disease is caused by a type of virus that's part of the enteroviruses family. The most common virus that you see is Coxsackie A16 virus. There are other strains where they can cause more severe forms, so that could be a Coxsackie A6 and even large outbreaks of enterovirus 71. Some of these kids, they can present with a rare presentation of aseptic meningitis. So that can actually lead to an infection and inflammation of the lining of the brain and or the spinal cord. So what are the potential things you need to look out for? So firstly, they usually start off with a fever. They would look tired or unwell. They would be refusing to eat or drink because of maybe some mouth sores or ulcers, and that can then lead to dehydration. After this, usually the rashes will start appearing on their hands, feet. They could even appear on their buttocks and around their mouth as well. The rash itself usually is a flat red rash, or they could be bumpy raised rashes, and eventually these rashes, they can evolve and become blisters. Those blisters eventually they will rupture and burst on their own, and they will form a scab or a crust over it. So the ulcers in their mouth, they can appear anywhere. It can be on their lips, it can be on their tongue, it could be at the back of their throat. These ulcers are very painful, and that's the reason why they refuse to eat or drink. So what are the treatments available for hand, foot and mouth disease? It's actually symptomatic treatments. So take a fever medicine when your child has a fever, and for mouth sores, because they could be painful, use an oral throat spray to help relieve some of the pain and help the ulcers heal faster. And if let's say your child has those rashes or the blisters, you can apply calamine lotion to help relieve some of the rashes as well. So if there are blisters on the skin, do not pick on it or do not rupture it. You should take your child to see the doctor if he or she develops a very high fever, or if the fever lasts more than 3 days, if they become severely dehydrated or have severe symptoms, they are looking very tired or miserable, if your child has a weak immune system, or if your child is very young, under the age of 12 months. So when can you send your child back to school or daycare? Because it's such a contagious infection, this illness can last for 7 to 10 days. Basically, you need to wait until all the blisters have burst and ruptured and all of them have a crust or scab over them. You should also wait until the fever has resolved and settled down, and also the ulcers or lesions in their mouth have all healed up. Hope you've learned something from today's session. Thanks for listening. Bye!